Hi, we are Christina, Aubin, Sam, and Allison from the OT program. Our study is the pilot evaluation of the computer-based assessment of non-cognitive attributes of healthcare professionals, also known as CANA-HP. Although tools have been developed for cognitive performance, a common tool has yet to be identified which can look at non-cognitive attributes of applicants into healthcare professions. Therefore, the purpose of this study was to develop an admission methodology which could effectively screen non-cognitive attributes of applicants seeking admission into healthcare programs at Wayne State University. The CANA-HP was developed by comparing Tracy and Sedlak's 8 constructs of non-cognitive skills important to the success of minority students to the core values of 4 health professions. 6 constructs were identified and went through the process shown on this slide, which ranged from questions developed by the primary investigator, feedback by content experts, and pilot applications with students. The final product included 6 open-ended or short answer questions and 6 multiple-choice questions. The primary purpose of this study was to examine the psychometric properties of the CANA-HP. 3 specific questions were delineated, focusing on different aspects of the methodology. 1. Reliability of the instrument. 2. Low construct validity with other measurements of cognition. And 3. Lack of bias of the instrument. The study received expedited IRB approval. To participate in the study, candidates had to be invited for an admission interview into the OT program, sign an electronic consent form, and be at least 18 years of age. Applicants were excluded if they did not meet this criteria. On the day of the interview, in February, the primary investigator met with the candidates to answer any questions. Candidates who signed the electronic consent were taken to the demographic questions on the survey. The candidates who did not sign this form were not included in the analysis. All data were analyzed with either SPSS version 25 or Eitman version 4.3. Descriptive statistics were run for the sample population as well as for each of the 12 stations of the CANA-HP. Data analysis consisted of the tests shown on the slide, primarily aimed at reliability, correlation analysis, as well as item difficulty, discrimination, and bias. 38 candidates were brought in for an interview and 37 agreed to participate. The participants were primarily female, Caucasian, with a mean age of 23 years. Reliability for the overall CANA-HP was assessed using Cronbach's alpha. For all 12 stations, the reliability was low and did not meet the minimum criterion level of alpha 0.7. A decision was made to run separate analysis for the multiple choice and open-ended questions. Reliability for the multiple choice stations was low, not meeting criterion. The open-ended stations, on the other hand, did have minimal acceptance level of reliability. Inner rater reliability for open-ended stations ranged from moderate to excellent. 2 types of construct validity were measured. First, the 3 types of GPA, undergraduate, science, and non-science, were analyzed for correlation to the multiple choice and open-ended questions. Non-science GPA was found to be significantly correlated with the open-ended stations. Second, GRE scores were not found to correlate with any other measure in this study. Item discrimination refers to how well an item can differentiate between the best and the worst performers on an exam. All open-ended questions had good discrimination, while only 1 multiple-choice question did. Item difficulty refers to how many students answer a question correctly. 50% of the questions had good difficulty for both types of questions. The remaining questions were either too hard or too easy. Finally, there was no statistically significant bias found for any of the measures shown on this slide. As mentioned previously, the study aimed to examine the psychometric properties of the CANA-HP. Reliability analysis revealed low correlation between multiple choice questions. However, the open-ended stations had minimally adequate reliability. The instrument had good inter-rater reliability, which ranged from moderate to excellent. The CANA-HP did not correlate with 2 measures of cognition, supporting the hypothesis the instrument does not measure cognition. Correlation to science GPA should be examined further, since non-science classes may measure different forms of intelligence. Finally, the instrument does not appear to be biased for 5 variables measured. There were limitations to this study. The participants were a small sample of convenience limited to applicants to 1 health profession program at the university where the study was conducted. Therefore, these results may not be generalizable. The 6 constructs used in the study may have been difficult to measure as a gold standard methodology does not exist. The CANA-HP remains a work in progress. The traditional multiple choice questions need further refinement as these 6 scenarios had low reliability and discrimination. Finally, predictive validity of this methodology is needed with practical application to students in health professions. Our references follow. Thank you for listening.